one will sometimes escape the barrier than we try to put in place. I don't know if you witnessed that in Sierra Leone. So you will tell us if it's part of the solution or part of the problem or both. It'll be interesting to get your views on that. For Dr. Sigueras, I was quite, and I thank you for the presentations, a point you did not really raise, but I think from Brazil, because of the interest around Zika, what was your perception of international cooperations? How did that work for you? I mean, well or not so well, vis-à-vis surveillance, vis-à-vis vaccine development, etc. That would be, I think, interesting. Also, your point on communications for rumors, to address rumors, which is a common issue, but maybe too big an issue to be addressed here. And then for Dr. Kandun, I was very pleased you mentioned the FETP, because I'm a strong supporter of the FETP programs. They provide the workforce we need. A question for you would be maybe two ways. One is about competing priorities, because in a country like Indonesia, when you have a cluster of H5N1, why after all do we start to invest in preparedness? Is that because WHO requested the pandemic preparedness plan, or and how you address these competing priorities when it comes to, for instance, gathering the right resources? And then you raise in one of your slides some very difficult questions that WHO has been faced during the H1N1 epidemics or pandemics. Was the issue of allocation of vaccines for many national plans? You know, who is going to receive first initial lots of vaccines? It's a very difficult issue. It will be interesting to see if that leads to issues. The same as, I mean, we're stockpiling, or the issue of donations. A lot of liability and legal issues behind donations, which are very complicated. So I don't think we need to enter into that. But these issues of allocation of vaccine as you develop the plan, how that leads to discussions and competition also. So that's food for thought as we go into to move on. So maybe we can start with answering this question, asking the panel, and then the audience will not ask more questions, and then the audience will come on board. So Dr. Elston, do you want to reply on this issue of the health system being the solution or the problem in such settings? Yeah. I hope you have a microphone that works. Yeah, I think it's...
Is that working?
Yeah.
Great. Yeah, thank you for the question. So you're absolutely right. So the healthcare facilities, healthcare workers were ill-prepared, had no facilities to isolate patients, very limited, if any, personal protective equipment. And we saw in, I didn't show the slides, but in Guinea, really the outbreak amplified manyfold once healthcare workers were infected, and certainly healthcare centres initially were foci of outbreaks in Sierra Leone. I think also it's interesting to compare with DRC. So in DRC, the setting is quite similar to rural Sierra Leone, Guinea, quite remote forested areas where you've had previous Ebola outbreaks. They've been contained very quickly because healthcare workers are in tune with a mysterious illness which kills people, and the alert goes through very, very quickly. Cases are isolated quickly, and there's laboratory capacity to diagnose cases relatively quickly. So the setting, as I say, is not much different. So yeah, I'd certainly agree with you that in the initial stages, health facilities were and transmission within health facilities, nosocomial spread, was certainly a big contributor to the way that Ebola became widespread in the country.
Yeah, I mean, usually healthcare facilities are the amplifier of a problem which usually, even with the burials and so on, remain sometimes quite localized. But when they reach the hospital in the cities, that was the case in Kikwik in 95, then it spread not just to few families that are linked to have something in common because they went to the same burial, for instance, but goes to healthcare workers coming from so different places within the city, and then it really starts the huge event. Yeah, on international collaboration in particular.
I think that Brazil is and was always very open to international collaborations regarding several topics, and Zika was not different from it. Initially, we had this close collaboration with the US CDC, but right now basically all the initiatives, the Zika Alliance, the Zika Plan, and other initiatives, they are all preparing to continue to work in Brazil. I think that we need to make the best of this moment because we don't know how long Zika is going to be around until the next cycle. It may take 7, may take 10 years to return. So we need to learn the most out of it at this point. And I think that sometimes it's harder to collaborate within the country than with external groups. And this is a challenge for us. And I just remembered something. Communication. Think about it. If there was a Zika vaccine available by the end of last year, there probably wouldn't be doses for everyone. Mm-hmm. And in Brazil, due to the huge success of our immunization program over time, the population relates vaccines to the absence of disease. Because most of the young people who are now using social media, they were already born in this era of vaccine-preventable diseases being almost eliminated in the country. And right now, we are discussing some new diseases that, like vaccines for dengue, for HPV, for perhaps Zika in the future. And there won't be doses for everyone. It's a different scenario. And I remember the last outbreak of yellow fever in the country. We ran out of vaccines because of bad communication. We ran out. How remembers it? Areas like Rio that are free of yellow fever. There were these huge lines in the health units waiting for vaccination. And the government couldn't do anything about it. Those people were there. They were giving them the vaccines. And areas that were endemic for yellow fever, which should be the main areas, the main target areas, a few of them, they didn't receive the vaccine. So we need to realize that we live in a very different scenario right now, that the pressure from the population is all around. Social media plays a very important role at this point. And we need to start to educate the population regarding the introduction of new vaccines. Okay, Zika vaccines, initially, they may be available when it's available for selected groups of the population and not for everyone.
Thank you very much, Dr. Sikera. And Dr. Kandun, what do you think about these issues of competing priorities in a country like Indonesia when you start to mobilize resources and why it works? I mean, why do you manage in a way to prepare for an outbreak or a pandemic which is not yet there?
Of course, we need to have a high level of political commitment. Actually, we are implementing what is so-called the risk approach. Risk approach. If we are talking about risk approach, so how to assess risk, to map risk, and to manage risk. And then if we are talking about risk, that there is one R equivalent to H times V divided by C. It means hazard. We have to find out where the hazard is. V means vulnerability. Which group is vulnerable to this hazard? And then we have to measure the exposure. Who is vulnerable? And then the most important one is we have to strengthen, to increase our C, capacity. Capacity to detect, capacity to prevent, capacity to respond. At that time, immediately the government of Indonesia allocated 200 billion rupiah for H5N1 vaccine from Baxter. And then at that time also there was a plan to transfer technology in order that biopharma would be able to produce their H5N1. But because of the change of the management, and then it was not happen. But at that time we discussed about who should be given. At the time has been decided if we only have a limited amount of vaccine, of course, healthcare workers should be number one priority. Number two, of course, army and police. And then, of course, the public servant who directly serve the community. The community. At that time, talking about H5N1, actually H5N1 is the disease of bird, disease of animal. They cross animal barrier, jump to human being. And at that time, we were worried about the human-to-human transmission. But up till now, there is no human-to-human transmission. Even we believe that H5N1 epidemic or pandemic will occur. It is just matter of time, when, where, and how. Because the ingredient is there. The ingredient is there. We are talking about what we call it, genetic drift, genetic shift, etc. And then competing priority, of course, with this calculation, and then we made advocacy to the decision maker. Who should receive the vaccine? And like what I have just mentioned, of course, the healthcare worker. At that time, for example, like the budget, not only from the government budget, but also from WHO, and also from European Union, and also from Australia, because we are living in the same world, how to make this world fit to live in. Of course, epidemic, pandemic, infectious diseases, do not respect borders. Realizing that, of course, it was very easy to get support from outside. At that time, for example, like for European Union, it was allocated for community health, 36 million euro, if I'm not forgotten. They could not spend. They must return the money back to Europe. But because of this H5N1 outbreak, and then it was very easy to get some million euro for strengthening our capacity, hospital capacity, lab capacity, and also for FETP and surveillance system. Now we are building also our EOC, under this global health security. Soon it will be. So actually, we use this opportunity to strengthen our capacity.
Nope. Thank you very much. I think that's a good thing. I think we're dealing again with 3 diseases which affect the poorest. At the same time, the 3 diseases raise a lot of concerns to the well-off. And that's probably why there is also this international support. The fear of international spread is always also a driving force we need to be aware of. I understand from the chair that there is 1-2 questions maximum from the audience, but I already see one over there. Yeah, please.
Yeah, great presentations. I think that in the spirit of the theme of this session, I guess I was hoping I would hear a little bit from you about the costs of the disruptions. And I wondered if any of you had given any attention or if there were any plans to try to, in fact, cost out what the implications were. So the descriptions were great, but I think it helps to also then have a good sense of how expensive it was. And I guess on the polio side with the Guinea, with the polio campaigns, the preventive campaigns being disrupted, we did have an outbreak there after. So there are some effects that were beyond even the ones that you guys covered. But could you just say a little bit about whether or not there are any activities underway to try to cost out what the implications of the outbreak were, or is that just too far?
Who want to answer? From the Ebola side, Dr. Elston?
Yeah, so, well, the World Bank described the economic impact on the 3 countries as catastrophic. I've written a review recently and quoting some numbers, but I can't quite remember them. But certainly GDP took a very big hit. So the consequences of the outbreak in terms of international trade were massive for those countries. Clearly, having border closures had a big impact. And in terms of international investment and international organisations basically left the country, that has a very big effect on the household level. So again, employment fell quite dramatically in Sierra Leone and Liberia, and still hasn't recovered since Ebola. So there was a very big economic hit to the country. I'm not quite sure whether you're referring to specific costs or.
vaccine programs? Not so much the cost of the outbreaks, but what in fact did it cost the health system, the vaccine programs to have to deal with the disruption?
Okay, well, I probably can't say that other than the vaccine programs were largely suspended for the time of the outbreak. Clearly, there was then a cost associated with the mass measles and polio campaigns in the summer. In our summer, May, June. But I'm not sure, I can't give you a figure on the cost of those, other than they needed to happen anyway. So with or without the Ebola outbreak, really the coverage was not optimal at all. I presume, there'd be a lot of international support for those mass campaigns, which wouldn't have been there without Ebola. But as to how much they cost, I'm not sure, sorry.
Always difficult to estimate costs of disrupted services, but there is a cost that everybody agree with. I think we're taking the second and last questions over there.
So it's a question both for Dr. Elston and Dr. Sekera, and this has to do with assessment of the clinical consequences of Ebola and Zika outbreaks that are not initially appreciated. With Ebola, long-term sequelae that are not appreciated at the acute time. And with Zika, certainly we know that microcephaly is the devastating tip of what's probably a very large iceberg. And so how do we value those? What impact do those have on health systems? And ultimately, as vaccines are developed and we think about the value of vaccines for these pathogens.
Dr. Sekera.
Well, I think that this is an amazing point for the discussions, but we need to understand the full impact of Zika. So far, as you mentioned, we're seeing perhaps the worst of it, but I fear that some other terrible news are still on our way at some point. That's why right now in the country, not only children born with malformations are being followed, but also the ones who had, the mother had a positive test during pregnancy. These are also being followed over time just to think about it, trying to identify everything else. And we have some early results of microcephaly post-birth, which is also shocking at this point. We have seen some other awful outcomes. Basically, the scalp for some of these children, they just collapsed. And this is terrible. I think that to see the numbers, read the papers and everything leads to one thing: to deal with these children on a daily basis. See the convulsions again and again and again and again at households, at the hospitals. This is the true burden of the disease at some point. And there's not quite a way to put a value on it at this moment. But I'm sure that what needs to be done at this time to fully understand the full spectrum of the disease, the initiatives are ongoing. We don't have the answers yet, but I'm pretty sure that we'll have it.
Okay, that was an interesting discussion, but unfortunately, we have to break now. I want to thank the panelists and Dr. Rodier. Jacques, I think it's the coffee break now. 15 minutes. Thanks.
Thank you very much.
Thank you, conductor. Okay. Merci.
Ouais, de rien, moi j'ai pas fait grand-chose.
Ah bah si.